intelligence and speech and language function. Then talking on the secondary manifestation, or I can call them an indirect impairments. Psychological dysfunction are very common and after an attack of stroke and are usually manifested as depression, social withdrawal, and anxiety. Sleep disorders, secondary mania, emotional liability, which can be pathological crying and laughing, emotional incontinences, behavior problem. There can be aggression, verbal abuse, or yelling, resistive behavior or overdependence. Even personal changes like an introvert can become extrovert and may appear very happy and over-talkative. Musculoskeletal complications. Musculoskeletal complication set in 95% of stroke patients if proper physiotherapy treatment is not given. It occurs mainly due to the combination of muscular imbalances and inactivities. Pain and stiffness are common and ones that affect various joints. However, certain joints are frequently involved like the wrist flexors, elbow flexors, shoulder adductor, pronator, and plantar flexors, knee extensor, and unilateral tightness of the neck, trunk, and lateral flexors on the spastic side. Decreased tone in the first stage commonly caused by subluxation of the glenoid joint on affected side if adequate care is not taken. The subluxation, if allowed to persist, may even give rise to periarthritis or frozen shoulder in the subacute stage. So the pain at the shoulder can trigger the incidence of LSD, which is reflex sympathetic dystrophy or shoulder hand syndrome, which is abnormal increased sympathetic overflow. It can occur in 3 stages, which I can start the stage 1, manifested by the burning, pain, and paresthesia, pitting edema, commonly on the dorsum of the hand, decreased wrist flexion range, cyanotic of the hand due to the vasoconstriction and increased sweating. Stage 2, in which there is an increased pain, decrease in sweating, and warm and more firm hand, osteoporosis involving the bone of the limb. Stage 3 gives rise to the undulated edema, atrophy of the bones and the muscle. The pain usually absent in this stage. The hand become fat. 6 physiotherapy neuro condition, cool and deformity occur due to the involvement of the soft tissue around the joint. Claw hand deformity is very common seen. So now the progression into this the third stage, like the sclerosis atticus syndrome, occur because the patient continuously assume a posture of a head flexion and shoulder internal rotation, scapular retraction. It is manifested as neck and the shoulder deformity with thinness and numbness in the hand and the finger. Then the DVT, or the deep vein thrombosis. Deep vein thrombosis in stroke is not as common as in spinal cord injury. It occurs due to the accumulation of a clot in the distal blood vessel. It is manifested as pain or tenderness in the calf muscles, swelling and discoloration of the leg. It can occur in hemorrhagic, mainly if the patient remains in comatose state for a long period of time. Cardiac and respiratory deconditioning. Also, the cardiac and respiratory system are not directly affected. Decreased physical inactivity, can also cause this deconditioning, of this system. So the patient endurance level is drastically reduced, which may adversely affect the rehabilitation process. The pain can also be commonly in stroke if the thalamus is also is involved, and is called thalamic syndrome, which is characterized by very intense burning pain on the opposite side of the body. And the GI and the renal system, also this system may not be directly involved. Rare or some patients with stroke do exhibit constipation and urinary tract infections.